Hello! In this course, we will be discussing the knowledge and skills you require to participate in supporting people with a disability to develop and maintain skills in order to maximise independence. Current practices require a holistic approach which includes consideration of a client's health and emotional well-being, as well as the competency to provide basic assistance to an allied health professional. By developing your skills to provide support for people to sustain quality of life according to individualised plans, you will deliver and maintain high standards of service. In your work, you need to work within a context of skill development and maintenance. This is different to a social role valorisation framework. You need to focus on how you can contribute to skills evaluations and ensure that you remain focused on providing active support. Using a strengths-based focus means that you need to encourage your clients to identify the things that they can do well and improve the things that they can't. In your work, staff are expected to show initiative and utilise incidental learning opportunities to enhance skills development as well as support implementation of outcome-focused and person-centred plans. When you are working with clients, you will be expected to assist them to develop skills in a range of areas: life skills, vocational skills, social skills, as well as developing relationships, maintaining physical health, personal safety, as well as other areas specific to the client. When you are working to develop skills with your clients, it is important that the activities you plan and do are relevant to the client's own situation. This could be skills they need to be independent in their own home, shared households, community group centres, or employment. The active tasks and things you do need to be relevant to the person, their life stage, and their environment. Contributing to skill development means that as a worker, you need to consider the life stage of an individual and have an understanding of the developmental framework. Having skills and abilities are integral to a sense of independence and empowerment. Regardless of the type of support being provided, health, therapy, care, or education, the principle of having the support provided be meaningful to the client is a basic concept. Your focus needs to be on achieving outcomes for the things that are most important to the person at the centre of the plan or review. What it is that they need to achieve and who will be responsible for actioning the plan or activities. In many cases, in your direct work role, this could be you. A good plan and your contribution will make clear the individual outcomes that the person wants to achieve and show how this is going to happen. By outcomes, we mean the things that are most important to achieve in the life of the person. Outcomes can be classified as belonging to a range of categories. Outcomes that are required for compliance or standards of care, outcomes that are important for the person's health, education and well-being, and outcomes that are important to the person relating to any aspect of their life. The support you provide needs to be active and evidence-based. What do we mean by active support? We mean that your role is to encourage people with a disability to engage as actively as possible in all living areas, not just do the tasks for them, and always looking for and identifying strategies and opportunities to maximise their participation, engagement, and independence. It is also important that you develop and strengthen your understanding of life stages. Growth and development is a process that affects every person from the hour of conception to the hour of death and forms a background for every medical and allied health discipline. If you are working in a social or community service, it is essential that you integrate and work within a developmental framework if you are to support your clients to achieve, develop and maintain skills. The needs, goals and ambitions of a person who is 25 years old will be different to a person who is 55 years old. It is common for workers to understand and integrate skill development when working with children. However, the importance of this often gets lost when supporting adults. Changes in body tissues and body systems occur throughout life, and so do the maturity indices of physical, cognitive, speech, and functional ability. This is why a person-centred approach is required when you are providing active support. It needs to be relevant to the person's age, interests, abilities, and life stage. When you are participating and contributing to an individualised plan as part of your work role, it is likely that you will be involved in a range of learning activities. These are categorised into formal, informal, and incidental or environmental. All three types of active support and learning are required to consolidate skills. Formal learning is structured and usually follows a set pattern of tasks, often written by an educator or a therapist. Informal learning will be less structured and may occur as part of a play or leisure-based activity. And environmental and incidental learning refers to the information that a person picks up just by experiencing, being a part of, or observing an activity being performed. For example, a client may simply observe you doing a task and later be seen to attempt the same task, or they may respond to an environmental sign because they associate this with an activity, such as fast food or a public toilet. To contribute effectively, you need to provide active support that incorporates formal activities, informal, and allows for incidental learning opportunities throughout the day. This includes carefully thinking and planning how you will plan your shifts, the layout of the area, and resources you can use in a home or centre-based environment, and being able to understand the best way to assist with skill development for the person you are supporting. What is the person-centred approach best suited to your client? A formal, step-by-step sequencing, or an informal mentoring and facilitating of a task or demonstration, where you actively do the task and explain to the client what you are doing and how you are doing it, or a combination of learning strategies. Moving on now, we will discuss the difference between assessment and evaluation, which can often be confusing. Evaluations are usually conducted by assistant and support staff, families and informal caregivers, whereas assessments are conducted by staff with additional training, experience and knowledge. There are a variety of formal and informal tools that are used to help identify skills, strengths or weaknesses, and it will be part of your role to assist not only with evaluations, but assessment information if required by health professional staff. Your contribution to an assessment may include completing an evaluation, filling in a feedback sheet about a client, or collecting and maintaining data about a client's behaviour, skill performance, or health measure, such as weight or pulse. An evaluation is different from assessment in that it is a subjective measure. Your opinion and judgment are required. The aim is to gauge a measure about the quality or level of independence that the person requiring support demonstrates. It's also task-orientated. What has the person learned, or what can they easily demonstrate? Your subjective feedback and opinion is required. This is different to an assessment, which is formative and more likely to be an objective measure that can be reviewed over time. Assessments are always process-orientated and reference a developmental framework or skill milestone set. And the key difference between an evaluation and an assessment is that an assessment will be diagnostic, identifying the cause of the issue, areas to improve, and therapeutic needs. In order to provide active support and participate in the implementation of individualised plans and allied health programs, you need to understand the planning process and then apply this to the active support you do. The process follows a set path. Firstly, identify the opportunities and strengths that the client has. What could they do and what could they do better? Determine the goals and objectives of support. What are we going to achieve? Understand what the limitations and obstacles will be. what will stop us from achieving this goal, and then consider any alternative active support options if needed and choose another way to achieve the goal or develop the required skill. Once your plan has been finalised, actively support and do the required activities. Make it happen. Then, review how the individualised plan is going on a regular basis and if progression towards improved skills and abilities is actually occurring as planned. The last part of the planning process is the review and re-evaluation. It is your role to review the active support that you provide and in many cases organise and plan a review that will evaluate the outcomes being achieved for the person with a disability relevant to the work that you do. It is important that staff understand the purpose of a review. It is not a time for a general discussion or chat. Outcome-focused reviews need to follow a formalised structure while at the same time be flexible enough that the client's feedback and input is easily considered regardless of their level of cognitive ability or social communication skills. The primary functions of a review are to ensure that the person is receiving the supports that they require, to check if needs have increased or decreased, to review the outcomes, make any changes that may be needed, and then also to ensure compliance with standards of care. There are secondary functions to review. It is an opportunity to develop networks and improve communication and strengthen the support team. It is also to promote achievements and strengths and celebrate these within the team, and also to explain and discuss policies relevant to the service being provided to the individual. When you're asked to contribute to an assessment or an evaluation, it's likely that the organisation you work with or a health professional will ask you to complete an evaluation tool or fill out an information form about the person being supported. It is important that when you use an evaluation tool that you carefully read the questions, instructions and complete the form in its entirety. Remember, if you are being asked to participate in this process, your organisation or the health professional assessing is interested in your opinion and judgment, regardless of your skill, experience or qualification. Remember, an evaluation is not a diagnosis or an assessment. In this section, we will consider some examples of evaluation tools to help you to become more familiar with scoring methods and terminology often associated with developmental and functional skill evaluations. The example shown here is a simple evaluation for eating and mealtime skills. This type of evaluation may be requested by a therapist or a caseworker. In this example, the skills to be evaluated are categorised into priorities, and the score is an evaluation of the level of independence, how independent the person is, or how much support is required in order to complete the task in its entirety. So the scoring system used here is 0 to 4. 0 meaning the person cannot do the task at all, i.e. it would require full facilitation to complete the task, and 4 meaning total independence and no support or supervision is required to complete the task. Once completed, it provides a baseline measure to look at the next review to gauge if the person's skills have improved, been maintained or decreased. Let's look at another example and how this works. In this functional education evaluation, a set of developmental tasks or skills are listed. The person evaluating is asked to provide feedback as to how well the person with a disability can complete the tasks without assistance. Scoring is simple. 0 means the person cannot do the task without full assistance, and 4 meaning they are completely independent. This particular evaluation sheet also could be used to guide specific activities and tasks that need to be practiced in order to achieve maximum independence across priority 1, 2 and 3 skills. After an evaluation is completed, all the data is collated and through a graphical analysis, in this example, we see the areas where the person has strengths, and then we also can identify skill weaknesses, and this can assist the care team to determine the next set of goals and activities that will be focused on. In this example, we can see that the green column indicates the maximum score possible for each of those priority skill areas, and this person has scored well on priority 1 tasks and skills, meaning these are strengths, and lower on priority 3 skills and tasks, which are harder tasks. It is therefore clearer that active support needs to focus on improving skills relating to the priority 2 and 3 category tasks if the outcome required is to improve the functional education and ability of the person. After completing an evaluation, it is very important to consider what the outcomes are and that what the person requiring support wants to achieve and needs to achieve. A good plan will make clear the individual outcomes that the person wants to achieve and show how this is going to happen. By outcomes, we mean the things in life that are most important to achieve. Outcomes can be categorised as those for compliance and care standards, outcomes that are required for a person's health, education and well-being, as well as outcomes that are important to the person. And this can be related to any aspect of life. Remember, individual outcomes can be big or small. Individual outcomes can also be to keep something the same as well as to change it. A good individual outcome plan will ensure that the elements of each outcome category are included in a person's plan. Now we will look at some of the elements of how to conduct an outcome-focused review. The ability to conduct a review is considered a basic skill required of staff who provide support to people with a disability. It is not considered an advanced skill, and the ability to conduct, participate and record information about a meeting or review will be an expectation of every person providing care and support. To help you to develop your review skills, you need to ensure that you're well prepared and consider a number of key areas before you participate in a review. Be clear about the outcomes that are needed to be achieved. List 3 most important tasks. Be able to clearly explain what is working, not working, the reasons why, and what your solutions are. Make sure that you allocate enough time to the meeting and think about who needs to be involved in the review. Before the review, check in with all the stakeholders as to how they feel things are working or not working so that at the review there are no nasty surprises. If the person has a personal budget, it's also a good idea to have the information on hand about how money is currently being used to fund supports and what hours of supports are available. Prepare your paperwork. Have photos or videos of evidence, a current and proposed timetable, and information about incidents and accidents that have occurred during the review period. After you've completed the review, and in most cases you should use a template to guide your meeting, this is the time to write up an action plan to achieve the required outcomes. What is the action required? What will be done? Who will do this? And when will it be done by? When you come to the next review date, you can then ensure that people are made accountable for their responsibilities, and by doing this, the success of an outcome-focused plan is more likely. Last but not least, formalise and sign the document to demonstrate every person's commitment to achieving the outcomes and implementing the plan. Persistence, commitment and patience are required to achieve positive change. In summary, the role of a support professional is to provide active support and by doing so, to participate in supporting people with a disability to develop and maintain skills in order to maximise independence, ensure a holistic approach which includes consideration of a client's health and emotional well-being, provide basic assistance to an allied health professional, including evaluations and feedback, and providing support for people to sustain quality of life according to individualised plans. This is current best practice and will ensure that you and your organisation continue to deliver and maintain high standards of service.